love talking about baseball. Listen, I even enjoy talking about politics in the state legislature. Dentistry, not among my favorite subjects to talk about, unless I have a dentist who's going to give you very, very good news about things like pain control. And Dr. Brian Harris, you son of a gun, with an office where?
Camelback and 32nd Street, actually Campbell and 32nd.
Oh, wait just a second. That's near my friends at Grand Orange.
Yep, right down the street.
And Postino?
Yep.
Well, now I understand how you control the pain. All that wine flowing back and forth, huh? But as a matter of fact, you are here to try to convince us, at least among other things, that there is such a thing as pain-free dentistry. And I believe it, but there's a lot of folks who don't.
Yep. No, in probably the last 2 to 3 years, it's really exploded in our profession.
Just in that short period of time.
So there's 3 to 4 new things out now that we never had before that are really changing the game and how we. Well, I mean, I would say I've brought a couple things to demo. This is probably the hottest new thing out right now, and it seems simple, but have you ever gone to the dentist where they give you a shot and they'll shake the cheek really fast?
Yes.
Ever do that? So
initially, I thought it was getting acquainted.
Yeah.
But why were they doing that?
So, and I've had patients even think that I was nervous and shaking.
Yeah.
But really, what it is, it's nerve confusion. So, as you shake the tissue, it confuses those nerves in there to not be able to feel every little sensation of the shot. So what Dental Vibe has done, it's a company that's come out with this device, and you can feel the pressure it puts on there. It lights up the area.
Yeah.
And it vibrates and oscillates to confuse that tissue so that you don't feel that initial shot. You don't feel all the sensation of what people hate the most about going to the dentist.
Among the other things that I hate the most is a dental hygienist grabbing my cheek and moving it around. I have never seen that before, and it works. And it works.
It's pretty awesome the way that it works to confuse things. Patients.
Now is that before the needle goes in with the lidocaine and those kinds of things?
So typically the best way to do it would be to start with like a topical gel where the gel goes in first.
Yes.
It kind of numbs up the area. Then you use the Dental Vibe you put that on the tissue and then give your injection. So as it's vibrating and confusing the tissue, you don't feel the needle going in. You don't feel all the, every little sensation that you would otherwise.
Yeah, because just simply to get to the point where you don't hurt, then you have to hurt initially. And with this new thing, that's sensational. How does one prepare for something like a root canal?
I mean, the best way to prepare for it is not to get too worked up about it. We were just having a conversation earlier about root canals are very different now.
I just had one a week and a half ago. I was amazed at the total absence of discomfort.
It's come a long way, and I would say the best thing somebody can do to prepare for that is don't get too worked up. In the waiting room, listen to some music you like to listen to. The night before, oftentimes for people to get really fearful, we'll even write a prescription for a Valium or something where they can sleep good the night before. Sometimes just the nerves and the anxiety make the situation a lot worse than it has to be.
All right, well, I have control over that, but I also have to control who's going to do the work. I've never found anybody that was ever able to give me a formula for picking a dentist.
Yeah. And it is difficult. I mean, nowadays, especially with all the marketing done by dentists, it's hard to know who is good and who is not. But luckily here in the Valley, we have a lot of great dentists. There's a lot of dentists that do a great job. There are certain products, so I would say, ask your dentist if they use them. A couple other things really quick. This will kind of blow your mind. On Pharma, this is actually an anesthetic additive that we...
Just hold that up so that everybody can see it. All right.
We add this to the anesthetic. Part of what makes the shot hurt is the acidity of the medicine. And so this neutralizes it to roughly the same pH as our body.
Sodium bicarbonate sounds like Tums or something like that.
It's been something that's used in medicine for a long time, and we're just finally introducing it to dentistry.
And what else?
The other thing is Auraverse. This is kind of cool. Most people, even the ones that don't mind getting numb, they hate being numb for 5 hours after the appointment.
Particularly if you do a talk show.
Yeah, I can see how that's a problem.
Right, it's really a turnoff to the audience to have a host whose lip is drooping, right, and you can't talk. So this changes that?
It's a shot that we give when we're done with the procedure that cuts that time in half. So it's not
Wow.
immediate, but instead of being numb for 3 hours after, it cuts it down to an hour and a half.
What kind of anesthetics should you ask for, talk about with your dentist, or avoid?
I would say there are anesthetics. The ones with epinephrine work the best. They get you the most numb. Okay. A lot of times, some people have reactions with those where their heart starts to beat fast. It makes them anxious.
Yeah.
So if that's the case, ask for an anesthetic that doesn't have the epinephrine. And those anesthetics are still great. They just don't last as long.
If I see an ad in one of the slick magazines here, and it says, pain-free, this is it, this is why you ought to come to me, are there any clue phrases or words that I should at least use as caution signs?
I think the best thing there is call your dentist and ask what it is that they're using to control pain. If they can give you answers of, we're using Onset, we're using Oraverse, we've got the Dental Vibe, we've got the topical. If they can give you answers of things that they're using to help control the pain, I think it's a pretty safe bet that they're going to do a great job.
Well, what about nitrous oxide?
That works great too. That's a whole other arena that we can talk about. But there's IV sedation for the patients that are really fearful. Probably the most common and most popular thing right now is what we call oral conscious sedation. You take a couple pills before you come in.
Wow.
Yeah. So you're awake during the procedure. If I say open, you're going to open. But oddly enough, you forget a lot of what happens after the procedure is finished.
And please keep in mind, you can only have nitrous oxide if you go in for a procedure. It's very, very important you know that. And also it's important that you know that this happens to be Dr. Brian Harris, 32nd and Campbell, and you can call Harris Dental if you choose to, right there and right there. Right here is the Morning Scramble.